Around 75 million, or about 75 billion Rwandan francs, has been donated by the United States Agency for International Development, USAID, as part of a 5-year agreement that will help Rwanda Medical Supply Limited in its responsibilities. The Chief Executive Officer of Rwanda Medical Supply Limited says the funding is needed to help with staff training and will have medicines in stock that are relevant to the market needs.
The first thing that will be maybe kicked out is, let's say, stock out. We had an issue of stock outs. So with this support, we are going to improve our data visibility so that will help us to procure based on the quantities needed. So that will help us to overcome stockouts, even expiries. So that is one. Another thing is it could take long to procure health products. So now with this support, with the capacity building, so we will make sure that at least it takes short period to avail needed health commodities. And the other thing we had, of course, we had capacity building issue. So this support will help us to also build the capacity of our staff so that they can deliver on time.
The project will begin with focus on the delivery of ARVs, anti-malarial drugs, contraceptives, and healthcare for parents and children. The Minister of Health notes that this financing agreement strengthens good relations between Rwanda and the United States through USAID. He adds that speeding up delivery of pharmaceutical services in the country through technology is one of the priorities of the project.
It's an agreement for 5 years, amounting $75 million, which will support the capacity building of this new institution, but also the procurement of different commodities, starting with HIV commodities, and later on it will be expanded to malaria and reproductive health commodities. So I'm very happy to have this partnership signed because it brings additional resources to improve operations here in RMS, but also to improve the management of the entire institution and to make sure that the use of data is really strengthened for decision making.
The USAID Mission Director for Rwanda says the organization will continue to work with Rwanda at various levels as the country continues to demonstrate good performance across different levels.
There's much to be done still, and any system needs to be strengthened to ensure the right data is used to kind of collect information to avoid stockouts, to ensure that prices are uniform and there is no markup at the end result, which is sometimes passed on to Rwanda's citizens, and of course to make sure that there is a good, strong system that can always have good information flow. These are things that we, through our partner, will be able to help the ministry and help RMS improve over time because, again, we have learned from other places and very much looking forward to be able to kind of give that support, technical support, and of course helping to fund the purchase of these key medicines, HIV/AIDS, as we said, and if we're lucky, and I know we will be, moving on to more important medicine procurements like malaria, mother and child mortality transmission medicines, etc. So again, very proud to be here today on behalf of USAID and the U.S. government to support this initiative.
The grant is expected to be issued in installments over the next 5 years. Gabi Muvunyi, reporting for RTV News.